Good afternoon, everyone. As before taking analysis and evaluation, we discuss about the topic symptomatology. So, what is symptoms? Symptoms are nothing but outward reflection of an internal derangement of vital force. And the symptoms are these are nothing but evidence of disease condition. We discuss about different type of symptoms. Out of those, one is subjective symptom, another is objective symptom. The subjective symptoms are those which are felt by patient himself, and as the patient express his symptoms, we can, according to his expressions, according to his how he express or how he uh, give details about his symptoms, his especially his sensations, his pains. So these are only the symptoms which we get through patient only, because it was not felt by the physician or not felt by the observer, the family members, relatives, friends, or any other person. So the subjective symptoms are totally felt by the patient. Then the second type of symptom which we discussed already, that is objective symptom. The objective symptoms, these are felt by patient as well as the bystanders, the physician, the family members, the friends, the relatives, everyone can able to observe these symptoms. So these are called as objective symptoms, and these are nothing but the sign of the disease. These perceptible changes are sure sign of disease and not mislead the physician. Then we discuss about common symptoms. What is common symptoms? Common symptoms are those which are present in many persons suffering from the same element. For example, breathlessness is common symptom of asthma. So as any disease condition, when we think about any disease condition, then which symptoms came in front of our eyes, which symptoms came immediately in our mind are the common symptoms of that disease condition. For example, as I told, the breathlessness is common symptom of asthma, headache and body ache. If there is fever, then headache and body ache. These are the common symptoms of fever. So in this way, there are some common symptoms which are the common symptom of that disease condition. Then uncommon symptoms. The uncommon symptoms are also called as characteristic symptom. They help individualizing a person, and these symptoms which drawn our attention because they stand out in group of symptoms. So these uncommon symptoms, according to our master Dr. Hahnemann, he called these symptoms as a PQRS symptom, because these symptoms help to characterize, individualize the patient, because these symptoms gives the characteristics of the individual. So the uncommon symptoms are very helpful when we homeopathy. Then the next, that is general symptom and particular symptom. In general symptom, as I told you that in general symptom there are again two type of general symptoms, that is mental general symptom and physical general symptom. So the general symptoms, these are important symptoms because these are the expressions of the person, and the mental general symptoms, these help to, these symptoms are helpful to know how the person is. So these symptoms are more important, and in mental general symptoms, I told previously we discussed that while considering mental general symptoms in symptomatology as well as in analysis, we discussed these things, that while considering the mental symptoms, we should consider first the will. Under the will, we have to consider elements from anger, then elements from bad news, grief, love, joy, reproach, hatred, irritability, jealousy, etc. And symptoms of love, hate, anxiety, and fear, they also came under will. So these are the first rank symptoms in mentals. Then after the symptoms related to will, we have to consider the symptoms related to understanding. And under that, we consider the delusion, hallucination, illusion, ideas, then thoughts, confusion, if there is any present. So all these came under understanding. And in repertory also we found the rubrics related to these mental symptoms, that is perversion of understanding. Some rubrics which we found in the repertory are absorb, clairvoyance, confusion, dullness, comprehension, ecstasy, then excitement, elements from mental exertion. These type of symptoms we found under the in the repertory also. Then after will, after perversion of understanding, we have to consider the perversion of memory. If there are any changes in the memory of the patient, then we have to consider these perversions. For example, loss of memory, absent-mindedness, etc. we have to consider. Then physical general symptoms, that is symptoms involving a whole person at the bodily level, and these we have to consider these symptoms because these symptoms are the symptoms of the man. So if there are any changes, if there is any disturbances at the most inner level, that means at the mental state, then first changes may appear at the physical general level. Under physical general symptoms, all desire of food, aversion of food, any food aggravation, then all the excretions like perspiration, urine, bowel, menstruation, then thirst, appetite, sleep, dreams, thermals, all these came under the physical general because these symptoms are directly related to the whole person at the bodily level. So These are very important symptoms. And then after we discuss about the particular symptom, all the symptoms that are predicated of any given organ are particular symptoms which pertain to the part and do not represent the whole person. The more they related to the anatomy of the part, the more they become unimportant for homeopathic prescribing. So these particular symptoms are also very much important because particular symptoms, these are the symptoms of organ, these are the symptoms of any particular part or any particular system. And the common symptoms related to that organ, that disease condition, they are not useful. But if there is any uncommon symptom, then definitely it will be helpful while reportizing the case or while finding out the similar. Modalities make a particular symptom important. So the modalities, if we found any changes in the modalities, in the aggravating and ameliorating factors, they are uncommon, and definitely they are helpful to find out the similarity. According to Dr. Boni Hussain, he gave more importance to these particular symptoms because according to him, these particular symptoms are easily and surely available while taking the case. You can easily get these particular symptoms. And they are very important, especially when we are treating the acute case. So in acute cases, in acute complaints, these particular symptoms, they are very much important. And when we get any characteristic, any uncommon symptom in this particular symptom, then it will be very much helpful in selection of final synonym while during differentiation of the remedy. So during final differentiation of remedy, such uncommon symptoms, they are very much helpful. And in acute cases, when we are using this symptom, then they are helpful for as a keynote prescribing symptoms. As I told, the common particular symptoms or the common symptoms of that disease, they are not useful when we are selecting the synonym because these are the common symptoms, and according to our homeopathy, we give importance to uncommon symptoms. So they are not very much important, but the uncommon symptoms, they are used as a keynote symptom, they are used as a characteristic symptom, and in acute cases and in chronic cases also for final differentiation of the remedy, these symptoms are very much helpful. Then after that, we discuss, or we are at this point, that is complete and incomplete symptom. So what is complete symptom? The symptom which is having location, sensation and modalities. This concept of complete symptom, it was given by our master Dr. Boni Hussain, and according to him, by taking the case, each and every symptom should be complete symptom. That means each and every symptom we should ask the patient about its location, about its sensation, as well as the modalities related to that symptom. And as this was the concept first time introduced by Dr. Bodimusen, but it was difficult to follow in practice. So he introduced the doctrine of analogy, which we already discussed in while learning, while studying the BTBD. So he introduced the doctrine of analogy, so that by using this doctrine of analogy, we can able to complete each and every symptom. And according to Dr. Bodimusen, the complete symptoms, they are not only help us to understand the case, but also they are helpful in repertorization when we are using Dr. Bodimusen's repertoire. Then incomplete symptom. This is about the complete symptom. Then incomplete symptom. So incomplete symptoms are those which lack any one or more of three elements, that is location, sensation, modality of the symptom. Bodimusen had advised method to overcome this deficiency in a symptom. So incomplete symptom is a symptom, as complete symptom is a symptom which is having location, sensation, modality, and from that we can understand what is incomplete symptom. The symptom in which there is lack of any one or more than one element in the symptom. That means there is lack of location, sensation, and modality. Out of these three things, lack of any one thing or more than one element or more than one thing out of these location, sensation, modality, it was not found in the symptom. Then it is called as incomplete symptom. And as I told just now, that if one element out of these three elements, that is location, sensation, modality, if any one element is missing in the symptom, any one or more elements are missing in the symptom, then to complete that symptom, he introduced the new doctrine, that is doctrine of analogy, as well as it is also called as doctrine of grand generalization. So it was many times asked for short note, what is grand generalization? So the students don't know, or they get confused in between grand generalization and grand symptom, or they don't, many times they get confused doctrine of analogy and grand generalization. It is nothing but the same concept. So what is grand generalization? Means if the symptom is incomplete by modality or sensation, then it could be applicable if the one part is having modality, sensation, then it can be applicable to whole person or the parts where we cannot get the modality and sensation, so that we can able to complete that symptom. Means there are 3 to 4 symptoms the patient was giving while narrating his complaints, and out of these 3-4 symptoms, we get only complete symptom is out of those 4 symptoms, is only one complete symptom and 3 symptoms are incomplete. Then at that time, we have to consider the modality and sensation of that one part as a whole person's modality and sensation, or they could be applicable to all the parts or to the whole person. And This is nothing but the principle of grand generalization or doctrine of analogy. Then after that, the chief symptom and concomitant symptom. So what is chief symptom? The chief symptoms are nothing but they are those which compel a patient to seek the help of a physician. Patient mentioned it first in case taking session. In a majority of cases, chief symptoms are describing in detail and physician do not face any problem in detecting them. Most of the time, these symptoms are common symptoms and they help the physician in diagnosis of the case. So, chief symptoms. What are chief symptoms? While taking the case, when the patient, which symptom the patient narrate first while giving his disease history, or which symptom the patient mention first while giving history to the physician. That is the chief symptom, that is the main complaint of the patient. And the disease condition, the complaint which compel a patient to seek the help of a physician. These symptoms, they due to these symptoms, the patient which came to physician, he take the help of physician. These symptoms are nothing but the chief symptoms. And in majority of the cases, by taking the case, the chief symptoms that it described in detail by the patient himself, and the physician, he cannot get or he cannot face any problem in detecting in taking chief symptom completely. Many times the patient himself, he gave the most elaborate way, in most elaborate way, he gave the information regarding these symptoms, these chief symptoms. And most of the time, these symptoms are common symptoms and they help the physician in diagnosis of a case. So these symptoms are nothing but many times in many cases it is also called as common symptoms of the disease and they are helpful or diagnostic symptom of the case. They are help to diagnose the disease condition of the patient. So these symptoms are very much helpful to diagnose the disease condition of the patient. Then concomitant symptoms. These are the symptoms which accompany or are associated with the chief complaint. In the majority of cases, it is noticed that patients do not mention these symptoms considering them insignificant. So most of the time, in majority cases, patients do not mention these symptoms considering they are insignificant symptoms, they are insignificant because they don't know the importance of these symptoms in homeopathy. The concomitant symptoms, they are not, there is no direct relation to the pathological condition of the patient. There is no direct relation to the chief symptom of the patient, but it is totally different symptom and present with the chief symptom. So these symptoms are very much helpful while finding out the simillimum, because with the help of these symptoms we can able to individualize the person, we can able to find out the exact simillimum, because these symptoms are nothing but the PQRS symptoms according to Dr. Hahnemann. And these symptoms, the PQRS symptoms, it was given the different name, that is concomitant symptoms, by Dr. Boninghusen. So these symptoms are very much important by selecting the exact simillimum, and many times these symptoms are present with chief complaint, but as the patient's chief complaint is different, the patient's main suffering is different, so he ignore to give details about this symptom to the physician. He cannot give the details about these symptoms to the physician. So many times while taking the case of the patient cannot give history, or many times if the homeopathic physician is new practitioner, then he also cannot ask in detail about the other symptoms which are present with the chief complaint. And at that time also, if he miss these symptoms, then he was not able to select the exact simillimum, and he cannot get, or after giving the medicine, the expected result which we cannot get. So the concomitant symptoms are very much important to find out the exact simillimum, as well as for individualization of the person. These symptoms are very much important. Then recent symptoms. So what is recent symptoms? These symptoms are those which have surfaced or are available as a later development in the chronic case. These division is done on basis of time and progress in chronic disease of long standing. Recent symptom indicates the trend and the direction of forward movement of the disease, and therefore they should be given due to importance when selecting a simillimum. By taking the history of the patient, especially in chronic diseases, the symptoms which we found which are developed at later, or there is later development in the symptom, especially in chronic disease, these symptoms which are not present since the as the disease started, but it found in the last stage of the disease condition when the patient approaches to physician. Just before that, the symptoms which we found, these are called as recent symptoms. And these symptoms, they indicate the trend and direction of the forward movement of the disease. how the disease may progress, how the disease, what is the next probability, or how the next progress or regress of the disease may be. These we can guess with the help of these symptoms, and they have given importance while selecting the simillimum, because with the help of these symptoms we can able to find out the direction of forward movement of the disease. So before going in the next step, we can stop the disease progress at that stage only. So these symptoms are helpful to stop the progress of the disease condition and find out the similitude. Then the old symptoms. The old symptoms are those which give a clue about the beginning of a chronic disease. They are not easily available in most of the cases due to lack of observation and understanding the significance on the part of the patient. Old old symptoms are help the physician to understand the original unmodified picture of the disease, symptom. So in this way, old symptoms, they are helpful, especially in by treating the patient homeopathically, because these symptoms, old symptoms, they give us how the disease condition starts, how the disease begins, and most of the cases, especially in chronic cases, we cannot get easily these old symptoms, because as the disease is chronic, the person was suffering from a long time, so easily the patient, he cannot remember all the symptoms at the time of commencement of disease, and so these symptoms are not easily available. But when we get these old symptoms, then with the help of these symptoms, we can able to understand what is the exact original unmodified picture of